And it's now my pleasure to welcome 3 members of our board for the presentation of this year's Health Transformation Awards. Please welcome Brad Olm, Larry Pribble, and Wendy Culver.
Thank you, Cheryl. Good morning, everyone. I'm Brad Olm, the Vice President of Human Resources for the Gordon Flesch Company and the current chair for the Alliance Board of Directors. I'm pleased to present the first 2 Health Transformation Awards this morning. First, a brief overview about the awards themselves. The Alliance Board of Directors introduced these awards last year as a way to recognize individuals and organizations that help move healthcare forward. We created 6 criteria for these awards and accept nominations throughout the year. A handout in your folders offers more information about today's award winners. Our first Health Transformation Award recipient today goes to Webcrafters Incorporated. Accepting the award for Webcrafters is Judy Pyrick and Renee Kennedy. Judy is the Vice President of Human Resources, and Renee is the Employee Relations and Benefits Manager. It's easy to talk a good game when it comes to moving healthcare forward, but it's harder to actually take real steps to do so, and Webcrafters has consistently done both. Their efforts began in helping found the Alliance in 1990. Jack Garner, President and CEO of Webcrafters, described this effort as the beginning of the idea that we could group together and represent a substantial portion of the employer market to gain some of the benefits of negotiated group rates from providers. During Webcrafters' 26 years of involvement with the Alliance, their leadership has been important in a number of areas. They've served on the board of directors, including terms as board chair by both Jack and Judy. Webcrafters has also been involved in organizations that partner with the Alliance, including the Wisconsin Collaborative for Healthcare Quality and National Cooperative RX. They pursued plan design initiatives that encourage employees to challenge the status quo by incenting them to access cost-effective providers, including some providers and facilities outside their local market. They committed to the Quality Path as an early adopter and led to Quality Path's first patient, and they've helped spearhead employer efforts to share best practices around wellness. Webcrafters is recognized for meeting 2 award criteria. First, improving quality of care using a systemic, process-oriented approach that can be adopted by other organizations. And second, in providing extraordinary leadership among employers related to health benefits, representing employers' interests, and developing a consensus on important issues. Please join me in congratulating Webcrafters Incorporated.
I just want to say a few words. The saying goes that it takes, I'm not tall enough to look over the top, so I'm going to stand to the side. It takes a village to raise a child, and Webcrafters is very proud to have been part of the conception of the Alliance and to watch it grow through adolescence and now into young adulthood. Last night I was reminded, as I was at the dinner of the honorees, of how much work there is yet to be done. And there's a lot to be done. But I was also encouraged in talking to the honorees and the speakers last night about how much we can accomplish no matter how small we are as an individual, as an organization. If we work together, we can really make a change. So my challenge is for all of us to continue the hard work in transforming healthcare, because together I think we can make a difference. So thank you very much for this award.
Our second award goes to Valerie Shields. As our first patient to use the Quality Path program, Valerie is an example of a brave consumer who willingly and actively pursued high-quality health care. In this role, Valerie demonstrated consumer engagement in a number of areas. First, she took the risk of enrolling in a brand new, yet-to-be-tested initiative called Quality Path, which included using her expertise as a registered nurse to research the program's quality measurements. Second, she switched her regular healthcare system to a Quality Path designated doctor and hospital for a high-stakes procedure. Valerie had a right knee replaced in April of 2015 by Dr. James Bowers at Meriter Hospital. Third, she educated healthcare system about the advantages of Quality Path, including sharing information with their primary care provider, the staff, and physical therapists at Meritor's Monona location. And fourth, she provided invaluable feedback about her experience as a Quality Path patient to her husband's employer at Webcrafters. And finally, she shared her experience as the subject of Quality Path testimonial in that terrific video many of us saw last fall at the annual meeting. Valerie is being recognized for advancing our understanding of how to engage consumers in making better decisions about their care and for exploring new approaches to delivering care. Please join me in recognizing Valerie Shields.
Good morning. My name is Larry Pribble. I'm the Chief Financial Officer with Tracti Building Systems and currently serve on Alliance's Board of Directors. I'm really pleased to be here this morning to present the third award to Natasha Plank-Ottum, CEO of Plank Enterprises. Natasha's approach to improving health care for employers in northwestern Wisconsin would feel familiar to employers who founded the Alliance. It's a grassroots effort that is employer-led, grounded in education, and focused on results. Natasha is a registered nurse who worked at the University of Wisconsin Hospital and Mayo Healthcare System before becoming the second-generation owner and CEO of the family-owned manufacturing company. Her company endured double-digit increases in their healthcare plan rates every year until premiums were almost unaffordable for the employees in the organization. Natasha knew she needed to make changes. Within a few years, she was able to greatly reduce premiums, eliminate annual cost increases, and achieve a total cost of care for each employee that is far less than the typical experience. Her remarkable results were rooted in hard work, collaboration, and risk. She collaborated with consultants across the country to find the best approaches for her organization. For example, she contracted directly with a local physicians group for on-site healthcare services. Employee benefits were modified to focus on long-term results and increased productivity. With her blended experience in business management and as a former practitioner in the healthcare delivery system, Natasha brings a unique perspective on the value of dedicated care, wellness as a long-term strategy, and designing patient-focused benefit solutions that support educated consumerism, improved access to care, advanced workforce health, and saves money. Combining her experience and her desire to educate and collaborate with employers, Natasha led the formation of Innovations in Healthcare at UW-Stout. This is a three-part series of interactive, dynamic education sessions which help employers with healthcare plan options, cost management strategies, and compliance with recent mandates. Natasha hopes that engaging more and more employers will ultimately give them a bigger voice in transforming healthcare in central and northwestern Wisconsin. Natasha was recognized on the basis of meeting all award criteria. She is a true champion of healthcare transformation. Please join me in recognizing Natasha. Say a couple words? Please.
Good morning. Thank you, Larry. Wisconsin, and particularly West Central Wisconsin, is a very high-cost market for healthcare claims, significantly higher than the national average. This is a serious economic issue for individuals, families, businesses, and communities. When it comes to purchasing healthcare, the status quo isn't working, and as of all of you at the Alliance know, employers must lead the charge. Innovations in Healthcare was developed to do just that, to educate employers on how to lead the charge in changing the way that healthcare is purchased, and to develop strategies that create a culture for a healthy workplace. Thank you to True Network of Advisors for collaborating on the project. Thank you to the University of Wisconsin-Stout Professional Education Department and the Manufacturing Outreach Center for continually meeting the education needs of industry and for embracing new innovations and promoting best practice for managing our healthcare supply chain. I'm honored and grateful to be recognized by an organization that rewards quality, value, transparency, and through collaboration and education, the Alliance helps to improve the well-being of the workforce and the sustainability of the employer partners. Thank you.
Good morning, everyone. My name is Wendy Culver. I'm the HR Director for Mead & Hunt, and I currently serve on the Board of Directors. I am very pleased to present the final 2 awards today, one of which goes to the Leapfrog Group. Accepting the award on behalf of the Leapfrog Group is CEO Leah Binder. The Leapfrog Group aims to trigger giant leaps forward in the safety, quality, and affordability of healthcare. Leapfrog is willing to take bold steps to achieve its goals. 5 elements of Leapfrog's work stand out. First, Leapfrog makes it possible for consumers to learn about the quality of hospitals before they are admitted through the Hospital Safety Score, which assigns grades of A, B, C, D, or F, just like in school, to hospitals based on their ability to prevent errors, accidents, injuries, and infections. The Alliance shares these scores with consumers on its Find a Doctor website. Second, Leapfrog has taken the gutsy step of using other data sources to assign a grade to hospitals that choose not to participate in its voluntary survey. Third, Leapfrog increases its impact by working with regional rollout partners, including the Alliance in the state of Wisconsin. Fourth, Leapfrog continues to talk about patient safety in terms that have helped move our discussion of medical errors from a vague general term into something personal that could happen to you, to me, or to someone else. And fifth, Leapfrog is employer-founded and focused on using employer purchasing power to recognize and reward improvements in healthcare safety, quality, and value. The Leapfrog Group is being honored for improving the quality of care using a systematic, process-oriented approach that can be adapted and implemented by other organizations. So congratulations to the Leapfrog Group and to Leah Binder. Would you like to say a few words? Please do.
Thank you. I hope you can hear me. Thank you so much, Wendy and Cheryl and all of the wonderful team here at the Alliance. We have loved working with the Alliance over the years. As Leapfrog has grown, so has the Alliance, and we're just so proud of our relationship with you. And I do want to thank our own staff. We have an absolutely amazing, committed, and very lean staff that do some incredible work with a lot of passion. I also thank our members, like the Alliance, and other employers and other members that we have for just 15 years of absolutely phenomenal work and boldness, and we thank you for being really a part of that. And I just want to call out one person here in the audience because many of you may not know this, but Madison, Wisconsin is actually, in many respects, one of the birthplaces of the Leapfrog model. Here at the University of Wisconsin, the science behind the Leapfrog Hospital Survey really was developed and turned into something that is truly noteworthy nationally. And so Dr. Barb Rudolph led the team at Wisconsin that worked on that for many years. Barb, would you stand up? I just want to recognize you. You were really part of Leapfrog. Thank you. So thank you all so much, and keep up the great work.
Congratulations. Thanks so much. Today's final award goes to Beaver Dam Community Hospitals, Inc. Accepting the award on behalf of the hospital is Kim Miller, President and CEO. Beaver Dam Community Hospital has been named to Leapfrog's annual list of top hospitals in the rural hospital category for 2 consecutive years. Only 24 rural hospitals nationwide achieved this honor based on Leapfrog's Top Hospitals methodology. Leapfrog's Top Hospitals program relies on metrics that can help produce higher quality of care for all patients. According to Leapfrog, top hospitals tend to have lower infection rates, higher survival rates for high-risk procedures, decreased length of stay, and fewer readmissions. In other words, Beaver Dam's commitment to quality is producing better outcomes for patients. Beaver Dam is also demonstrating community-wide leadership in transforming healthcare by partnering with Healthways to introduce the Dodge County Blue Zones Initiative. This well-being initiative aims to encourage changes to local environments to help people make healthier choices. The goal is to enlist all elements of the community, from work sites to schools to restaurants to grocery stores, in the effort to improve and achieve better health. Beaver Dam Community Hospital is being recognized for improving the quality of care using a systematic process-oriented approach that can be adapted and implemented by other organizations. And with that, I'd like to congratulate Kim.
Thank you very much. I want to say thank you and for this recognition on behalf of our board, our medical staff, the administration, all of our staff and our volunteers. It was mentioned earlier that it takes a village. It truly does take a village of care team members to deliver excellent care. One of the things that we did approximately 8 years ago was we rewrote our vision and mission statement. And at that time, we included the triple aim in that statement. And we did that very deliberately because we knew that we wanted to begin to work on this. We have worked very hard as a whole team. There are approximately 1,300 people on our care team. And so we work very hard as one unified team to improve the quality and care that we deliver. You mentioned our Leapfrog recognition. We're proud of that. The first year that we submitted our data, we received a C. We were not proud of that. And I told Leah this last night. I went back to our staff and I said, we obviously have some work to do. And they agreed, because that's not the kind of care that they would like for themselves or for any of their family members. And so we worked very hard that next year, and we were very proud to receive an A. We have received that A for 3 consecutive years. We are one of 153 hospitals nationally, Leah, correct me if I'm wrong, that have for 3 consecutive years received an A. We are also the only Wisconsin rural hospital to have a top hospital award from Leapfrog. We are also very proud of that. It is something that takes a lot of effort. When we included the triple aim in our statements, the one thing that we have not yet achieved, but we're working on right now, is reducing the cost of care. That's something that we know we need to improve. Approximately 6 years ago, we began some grassroots efforts on lean, and 2 years ago, we began a very formal program on lean. We are seeing some remarkable improvements in reducing the cost of care from that work. And again, it's engaging that entire care team of 1,300 people. One of the things that I always say during orientation to our staff, and we actually have a deliberate orientation process that goes over 2 different time frames, but the first orientation time frame is, regardless of when someone comes into our doors, we offer a full continuum of care, birth through death. We also have hospice and home care. And so when someone comes in, regardless of whether they're coming in for a lab test, or they're coming in for a surgical procedure, or they're dropping their child off at our kids' care for the very first day, they are very frightened. They are placing their lives in our hands. And I actually ask our employees to hold their hands out. And I ask them to think about the person that is most important to them. Because every person that walks through our doors is giving us the privilege of caring for them. And when they place their lives in our hands, it is our job as a unified care team to assure that when they leave the hospital, they leave kids care, they leave any of our buildings, that we have done an exceptional job of caring for them. And they take that honor and that privilege very, very seriously. So again, I just want to say thank you on behalf of all of our care team for this recognition. They are very pleased to receive this, especially during hospital week. So thank you very much.
Thank you so much. Congratulations to all of our award recipients this year. We're delighted to recognize these organizations and individuals for their impressive work to transform healthcare.